Do you know what foods pregnant women should avoid? It's not just a question of curiosity, but a matter of well-being for both mother and child. The importance of mindful eating during pregnancy cannot be overstated. Navigating the world of nutrition can be tricky, especially when you're eating for two. Today, we're going to explore some specific food items that, while seemingly harmless, are best avoided during this precious period of life. Stay tuned as we dive into the specifics of food items that pregnant women should avoid. First on our list is high mercury fish. Mercury is a naturally occurring element that, in high levels, can be harmful. Certain types of fish, such as shark, swordfish, and king mackerel, are notorious for their high mercury content. You may wonder, why is mercury a concern? Well, when consumed in large amounts, it can have a detrimental effect on our health. For developing babies, exposure to high levels of mercury can specifically impact the development of their nervous system. This includes the brain and spinal cord, which are crucial for controlling all bodily functions. Even small amounts of mercury can interfere with brain development, leading to cognitive difficulties in learning and memory. That's why it's especially important for pregnant women to pay heed to the types of fish they consume. So let's be mindful of the food we eat. Remember, not all fish are created equal, so it's best to avoid high mercury fish during pregnancy. Next up is undercooked or raw fish. Now, who doesn't love a good sushi roll or a platter of fresh oysters? However, these delicacies can pose risks if not prepared and cooked properly. Consuming undercooked or raw fish exposes you to potential bacterial and parasitic infections. Bacteria such as Listeria and Salmonella are notorious for their presence in undercooked fish. They can cause severe food poisoning, leading to nausea, vomiting, and even fever. Parasites, on the other hand, can lead to conditions like anisakiasis, a nasty little worm that can cause severe stomach pain and other digestive issues. Common sources of undercooked or raw fish include sushi, sashimi, ceviche, and raw oysters. These foods are delicious, no doubt, but they require meticulous preparation and high standards of hygiene to ensure they're safe to eat. So while we understand the allure of these delicacies, it's essential to prioritize your health. As a rule of thumb, always ensure your fish is well cooked. Undercooked, raw, and processed meats are another category to be mindful of. Navigating the world of meats during pregnancy can be a bit tricky. Consuming undercooked or raw meats can expose you to harmful bacteria and parasites. Two key culprits to look out for are Listeria and Toxoplasma. Listeria can lead to severe illness or even miscarriage, while Toxoplasma may cause flu-like symptoms that can have serious implications for your baby. The story with processed meats is a little different. These products often contain nitrates and nitrites as preservatives, which have been linked to various health issues. Plus, there's the increased sodium content that can lead to elevated blood pressure. So what's the takeaway? Cook your meats thoroughly, making sure they reach a safe internal temperature. And when it comes to processed meats, consider them a once-in-a-while treat rather than a staple. When it comes to meat, it's always better to err on the side of caution. Raw eggs are another food item that pregnant women should avoid, and here's why. Consuming raw eggs can expose you to Salmonella, a bacteria that causes food poisoning. Salmonella is especially risky during pregnancy as it can lead to severe complications for both the mother and the baby. Now you might be thinking, I don't eat raw eggs, so I'm safe. But raw eggs are sneakier than you might think, often hiding in foods you'd least expect. Consider homemade mayonnaise, a commonly used condiment. It's made with raw egg yolks, which can harbor Salmonella. And it's not just mayonnaise. Certain salad dressings, homemade ice cream, and even some protein shakes can contain raw eggs. So here's the takeaway. When you're cooking or baking, always make sure your eggs are well cooked. And when dining out or buying pre-made food, be sure to ask if it contains raw eggs. Always ensure your eggs are well cooked before eating. Unpasteurized dairy and juices are next on our list. Now, why should we be cautious about these? Unpasteurized or raw dairy products and juices haven't undergone the heat treatment known as pasteurization, which is designed to kill harmful bacteria. Without this process, these products can potentially harbor bacteria like E. coli, Listeria, and Salmonella. Let's take a closer look at common sources. Unpasteurized milk and cheeses, particularly soft cheeses like brie, camembert, and certain types of blue cheese, can pose a risk. Fresh squeezed juices are another common source of unpasteurized products. While they might seem like a healthy and refreshing choice, without pasteurization, they could be a breeding ground for harmful bacteria. But don't worry, you don't have to give up your favorite cheese or juice completely. Just make sure to opt for pasteurized versions. They're just as delicious and much safer. Remember, it's all about making smart choices for you and your well-being. To stay safe, opt for pasteurized versions of these products. Lastly, pregnant women should be mindful of their caffeine intake. Now, we're not saying you have to ditch your morning cup of joe entirely, but it's important to understand that excessive caffeine consumption during pregnancy can potentially lead to complications. Studies have shown a link between high caffeine intake and an increased risk of preterm birth and low birth weight. So how much is too much? While the exact safe limit can vary, most health experts agree that keeping your caffeine intake below 200 milligrams per day, that's roughly the amount in a 12-ounce cup of coffee, is a safe bet. Remember, caffeine isn't just in coffee, it's also in tea, chocolate, some soft drinks, and certain medications. So it's essential to keep track of your total daily intake. So while a cup of coffee isn't off limits, moderation is key. To wrap things up, let's quickly revisit the foods we've discussed today. The goal here is not to intimidate or overwhelm, but to empower you with knowledge. Knowledge that can help ensure a healthier, safer journey through pregnancy for both you and your little one. Firstly, we delved into the world of high-mercury fish. While some fish can provide beneficial omega-3 fatty acids, high-mercury varieties like swordfish, shark, and king mackerel are best left untouched. Mercury can interfere with your baby's developing nervous system, so it's better to stick to low-mercury options. Next, we discussed undercooked or raw fish. Sushi and sashimi are delightful treats, but during pregnancy, they're off the menu. Raw or undercooked fish can carry harmful parasites and bacteria, posing a risk to both you and your baby. Then we moved on to undercooked raw and processed meats. These can harbor an array of harmful bacteria and parasites. It's crucial to ensure that your meat is well cooked and to steer clear of processed meats as much as possible. We also talked about raw eggs. They can carry salmonella, a bacteria that can lead to serious illness in pregnant women. So it's goodbye to raw cookie dough and homemade Caesar dressing for a little while. Unpasteurized dairy and juices were also on our list. They can contain harmful bacteria such as Listeria, which can lead to serious complications. Opt for pasteurized versions to ensure you're getting the nutrients without the risk. Lastly, we touched on excess caffeine. While a moderate amount might be okay, it's important to limit your intake. High levels of caffeine can lead to issues such as preterm birth and low birth weight. Remember, maintaining a healthy diet during pregnancy is crucial for both you and your baby. Always consult with your healthcare provider if you have any questions or concerns about your diet.